Hello there. How are you? I'm
Hi,
Jeanette, the speech
I'm
pathologist.
Stephanie, Melvin's wife, and
Hello.
this is my granddaughter.
I'm Danielle.
Hi there.
Nice
Pleasure
to meet
meeting
you.
you.
Nice to meet you too.
So what brings you in today?
Well, I sent Melvin to the store to get eggs, milk, and bread one day, and he came back with cookies and milk. This has been an ongoing problem, and we decided to have him evaluated by Dr. Sage. And Dr. Sage suggested that we come to a speech pathologist, so that's why we're here to meet with you. They finally diagnosed him. They diagnosed him with semantic dementia.
Okay.
Yeah, to us, it sounds like he's just forgetful. Like he doesn't remember simple things that we tell him. It doesn't sound really severe either. Can you further explain what dementia is so that we have a better understanding?
Sure. So dementia is a neurodegenerative disorder. That means parts of his brain are slowly decaying, which is why you see some impacts in Melvin's behavior. In this case, the early stages may impact language. It may become empty and vague. It might become repetitive, and in the long run, he might lose his ability to communicate overall.
All right, but how did he get this? He didn't have a major accident. There wasn't a stroke. And I just thought all old people lost their memories.
Okay, well, the entire elderly population does not get dementia. There are lots of myths and misconceptions concerning dementia. Some people believe that memory loss is natural, that sweeteners might cause it, and that it's not fatal. In reality, some risk factors for dementia include advanced aging, family history, head trauma, and strokes. So Melvin's semantic dementia was probably caused by advanced aging.
I didn't realize that there were so many different types of dementia.
Okay.
Um, what exactly is semantic dementia?
Okay. Semantic dementia is characterized by verbal and nonverbal abilities. This means that he has difficulty with word meaning due to lack of activity in his temporal lobes, which is right here in the sides.
Okay, so what are some of the symptoms that he might get? Like, what should we be looking out for?
So you might be able to see some difficulties in expressing words, empty speech patterns, struggling to name people he already knows, loss of muscle control, and changes in his personality. Have you guys seen any of these things or maybe other things?
Yeah, actually, I went to the store with him last week. He goes there at least once a week. He knows the cashier by his name.
Okay.
But when we were there last week, he looked at the guy like he knew him, knew
Okay.
who he was. He couldn't remember his name, and you just felt so bad for him. I know it was really hard.
Okay.
Grandma, do you see any of this at home too?
Yes, we noticed changes. He is less attentive, and Melvin used to tell elaborate stories and made such specific details in each story that he told. But now he tells less stories and he needs help explaining things.
Okay.
And it's hard for him to find words to explain what he's trying to say. What kind of therapy can we use to help him?
Well, it seems that Melvin is exhibiting classic textbook symptoms of dementia. As far as treating it, some people have different options. Some families believe that changing diets to exclude meats help because they feel vegetables can help strengthen the mind. They feel meditation also helps with focus. And some other people believe that pharmaceutical medications are best.
I mean, Grandpa's not going to cut out meats out of his diet.
Oh
he
no,
really
Melvin loves his meat.
Yeah, he really likes to eat meat. He's already taking so much medication too. I feel like that's just not a good route to go. And meditation just doesn't seem like it would work for him. You know, he's older, and to sit there and meditate in a silent room might be hard. So, what treatment are you going to use exactly?
I'll be using anomia therapy, so there's no need to change his diet or meditation or add any medication to his list. So what it basically means is that it includes categorizations, object meaning, and naming comprehension. Essentially, I'll be able to give him a picture, and he will tell me the name of it, what it means, and the name of it.
So how is anomia therapy going to help Melvin? It seems like it's a game that children would play.
Well, I understand why you feel it's a little too simple for Melvin, but actually it helps with output and core conceptual knowledge. Drilling these things will help strengthen his affected lobes in his brain and get things jogging again.
Alright, so is he ever going to get better? I miss the way Pop Pop used to tell me stories. He just seems frustrated when he's trying to figure out these words, and he doesn't seem as happy as he used to be.
Well, truthfully, since it's a progressive disorder, the temporal lobes will slowly be affected. This means that things may slowly get worse, and overall, he might lose his ability to communicate.
So what are you trying to say? He won't remember his family?
Well, it depends. It really depends. It varies with each client. Just remember that family support is key. It really is key. And just bringing him for therapy every week will really help him.
Can you give us some materials that maybe we can start doing something at home to help him?
Sure, of course. So I've already made this packet for you guys to bring home to Melvin to work on with him, as well as these also include information. And I'll definitely be looking forward to working with you and Melvin every Thursday.
Thank you so much.
You're
I
very
really
welcome.
appreciate
Thank you.
you.
No problem. No
Nice
problem.
meeting you.
Nice
Take
meeting you
care.
Thank you
also.
for all your help.
No problem.
Let's go.